Hi, my name is Felicia Day Freeman, and today I am performing my remediation for the central line dressing video. So the first thing I would do is to perform hand hygiene. I'm going to go into my patient's room, knocking on the door, introduce myself, let them know that I'm here to perform central line dressing, to clean it and everything, ask for their name and date of birth because I need two patient identifiers, close the door for patient privacy, and then I can proceed. So I want to go ahead and perform hand hygiene. I want to go ahead and apply my mask. So I'm going to be applying my mask, and then I am going to apply some clean gloves. And as you can see, I have all of my supplies. I have my mask, pair of clean gloves, chlorhexidine. I also have my sterile gloves, my Tegaderm, and my two gauze, so I can go ahead and use this to clean my central line dressing. I don't have the kit. I lifted most of it like at DFC because this is my remediation. So after performing hand hygiene, applying my mask, and applying my clean gloves, I would offer a mask to my patient. If they decline, I will go ahead and have them turn their head to the side to make sure I maintain sterility. Next, I want to remove my dressing from the central line. And it's just here, just some gauze that I used because I didn't have additional Tegaderm or Band-Aids. So I want to make sure I remove it from all four corners, being sure to remove it parallel to the skin. So I'm going to go ahead and start removing it that way. Okay. And then this I will discard in the trash. All right, so during this time, I want to go ahead and inspect my central line dressing. I want to inspect the skin. I want to make sure that it's intact. I want to make sure that the CVAD is intact. I want to inspect the catheter, the insertion site, make sure that it's okay, make sure there's no drainage, and that it's also in the correct place. So now that I've done that, I can go ahead and discard these gloves and then perform hand hygiene because I need to get ready to perform my sterile technique by donning my gloves and everything like that. All right, so I'm gonna go ahead and perform hand hygiene, and then I want to go ahead and don my gloves. So I'm gonna move this over a little bit so that you can see. So if I had the kit, I would take it out, making sure to only touch the corners, right? Which is the four corners here. And then this, I will go ahead and just move out the way again by discarding it. All right, so I'm gonna go ahead and take my chlorhexidine. I want to make sure that it snaps because that's how I'm gonna go ahead and get all the solution out. Once I do that, I'm going to make sure that I clean for 30 seconds. And I'm gonna make sure that I clean the tubing last. So, so I'm gonna go back and forth, but I want to make sure I'm not doing like the same sides. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And cleaning my tubing last, I'm going to take my piece of gauze here and being sure to hold it here. And then I want to clean it last. So once that's done, I'll go ahead and discard my chlorhexidine. And then I want to allow it to dry for 30 seconds. And once that's done, then I can apply my Tegaderm. So when applying the Tegaderm, I want to make sure that I'm pushing down all four sides firmly, making sure that I initial and date my bandage as well. So making sure it's pushed down all four sides firmly. As you can see, it's nice and firm. All right. And I will make sure to, again, initial a date. It's just this tape here. And place it here. Once I'm done with all that, I want to go ahead and discard all of my items here. Make sure my patient is comfortable. I want to get rid of these dirty gloves. Perform hand hygiene. Again, make sure all that is already discarded. Perform a hand hygiene and go ahead and document. Thank you.